Imagine waking up one morning feeling completely normal, only to discover that your body has been silently deteriorating for months. By the time you finally notice something is wrong, it might already be too late. Diabetes is more than just high blood sugar, it's a silent, ticking time bomb. Each year, more than 100,000 people lose their lives due to its complications, and the most alarming part is that many of them had no idea what was happening inside their own bodies. Most people believe they'd recognize the warning signs, but diabetes is incredibly deceptive. Its symptoms creep in gradually, masquerading as everyday tiredness, mild aches, or simple stress. Then, without warning, a heart attack occurs, an infection spirals out of control, or an organ begins to fail. In this video, I'll expose the 7 deadly diabetes symptoms that can strike suddenly and without any clear signs. These are the silent killers, symptoms that, if ignored, can lead to coma, limb amputation, or even death. Number 1 on the list is the most dangerous of all, and it's the one that most people tend to overlook. Stay with me until the end because knowing these symptoms might truly save your life. Number 7, diabetic ketoacidosis. Diabetic ketoacidosis, or DKA, is among the most dangerous and life-threatening complications of diabetes, and what makes it especially terrifying is how rapidly it can strike. When your body doesn't have enough insulin to process glucose for energy, it begins breaking down fat instead. This process releases toxic substances known as ketones. As ketones build up in your bloodstream, they make your blood dangerously acidic, essentially poisoning your body from the inside out. Without immediate treatment, DKA can cause organ failure, send you into a coma, or even lead to death in just a matter of hours. What makes DKA especially frightening is the speed at which it progresses. It often begins with subtle symptoms, such as excessive thirst, a dry mouth, and frequent urination, signs that are easy to ignore or attribute to something less serious. But as ketone levels continue to rise unchecked, the symptoms intensify. Nausea, vomiting, intense fatigue, and severe abdominal pain begin to set in. A distinct fruity smell on the breath is another major red flag, signaling that acid levels in the blood have reached a dangerous tipping point. While DKA is more commonly associated with type 1 diabetes, it can also affect those with type 2, particularly during periods of illness, infection, or when insulin doses are missed. Triggers like stress, dehydration, or certain medications can also set off a sudden episode. Because the condition deteriorates so quickly, it's vital to monitor both blood sugar and ketone levels closely, especially if you're feeling sick, weak, or mentally foggy. If you notice any signs of DKA, seek emergency medical care immediately. This condition is not something you can treat at home. It requires urgent administration of intravenous insulin and fluids to flush out the excess acids and restore the body's balance. Any delay in treatment can lead to irreversible consequences, including coma or death. If you live with diabetes, always have a plan in place to both prevent and respond to DKA. Being prepared can make the difference between life and death. Number 6, heart attacks and stroke. Diabetes is a silent predator when it comes to your heart and brain, quietly damaging your cardiovascular system and doubling your risk of experiencing a heart attack or stroke. Over time, elevated blood sugar levels thicken the artery walls and fuel dangerous inflammation, restricting blood flow to vital organs. Even more alarming, diabetes can impair the nerves that detect pain. So many individuals never feel the classic warning signs before a heart attack hits. By the time they realize something is wrong, the damage may already be irreversible. Unlike the intense, crushing chest pain people often associate with heart attacks, diabetic heart attacks frequently present with subtle, misleading symptoms. These can include sudden shortness of breath, dizziness, nausea, overwhelming fatigue, or even discomfort in the jaw or upper back. Tragically, many people with diabetes brush these off as stress, aging, or fatigue, completely unaware that their heart might be moments from catastrophic failure. Strokes present a similar risk. What may begin as mild confusion, blurred vision, or weakness in a limb can rapidly escalate into permanent brain damage. These signs are easy to overlook, but can become life-altering in mere minutes. High blood pressure, elevated cholesterol, and obesity, conditions frequently linked with diabetes, intensify these risks even further. If you live with diabetes, it's absolutely critical to monitor your blood pressure and cholesterol on a regular basis. And if you notice unusual symptoms, take immediate action. Do not wait. Heart disease in diabetics has earned the nickname the silent killer. For a chilling reason, most people never recognize the danger until it's far too late. If you suddenly experience unexplained fatigue, difficulty breathing, dizziness, or discomfort in your chest, jaw, or left arm, don't hesitate. Call emergency services immediately. Quick medical intervention can stop a heart attack or stroke in its tracks and prevent permanent damage. Just because a heart attack or stroke is silent doesn't mean it's harmless. It simply means you may not get a second chance to recognize the signs. Number 5, kidney failure. Your kidneys serve as your body's filtration system, removing waste and excess fluids from your blood. But high blood sugar levels from diabetes can quietly and relentlessly destroy this vital function without you even knowing. Over time, uncontrolled diabetes damages the delicate blood vessels in the kidneys, reducing their ability to filter properly. This destruction happens slowly and silently, with no pain and no clear warning signs until kidney failure is dangerously close. By the time many people with diabetes realize their kidneys are in trouble, dialysis or a kidney transplant may already be their only options for survival. One of the earliest signs of kidney disease is frequent urination at night, as your kidneys begin struggling to flush out excess sugar and fluids. Swelling in the feet, face, or hands, along with constant fatigue and unexplained nausea, are additional red flags that your kidneys are under increasing stress. As the damage progresses, toxins begin to build up in your body, leading to high blood pressure, persistent itching, and even confusion or mental fog. These symptoms are often mistaken for other, less serious health problems, delaying diagnosis and allowing the disease to worsen quietly. Shockingly, 1 in 3 adults living with diabetes will develop kidney disease, and many will remain unaware until the final stage, complete kidney failure. At this critical point, dialysis becomes a medical necessity just to stay alive, as the kidneys can no longer perform their essential role of removing waste. Without this life-saving treatment, toxic buildup happens quickly, potentially resulting in seizures, coma, and ultimately death. That's why it's absolutely essential for diabetics to get regular kidney function tests, even if they feel perfectly fine. Staying ahead of the damage is key. Keep your blood sugar tightly controlled, remain well hydrated, and schedule routine checkups with your healthcare provider. Kidney failure doesn't strike overnight, but by the time symptoms finally emerge, the damage is usually irreversible. Number 4, severe hypoglycemia. While many people associate diabetes with dangerously high blood sugar, low blood sugar, known as hypoglycemia, can be just as lethal, and it can strike without warning. Hypoglycemia occurs when blood sugar levels drop too low, depriving the brain of the glucose it desperately needs to function. Within just minutes, this lack of energy can cause confusion, unconsciousness, seizures, and even sudden death. What makes it even more frightening is that many diabetics don't realize it's happening until it's far too late. Early signs of hypoglycemia include shakiness, sweating, dizziness, and sudden feelings of anxiety. as the body scrambles to fix the imbalance. But if blood sugar continues to fall, these mild warnings escalate into more dangerous symptoms: slurred speech, blurred vision, disorientation, and physical weakness. Without rapid correction, the brain begins to shut down completely, potentially leading to coma or a deadly heart arrhythmia. For some people, especially those with a condition known as hypoglycemia unawareness, these warning signs may never appear at all. There are many triggers for a hypoglycemic episode: skipping meals, taking too much insulin, or engaging in intense physical activity without adequate food intake can all cause a rapid and dangerous drop in blood sugar. Older adults and those with long-standing diabetes are particularly vulnerable, as the body's natural ability to sense low blood sugar declines over time. Without quick intervention, severe hypoglycemia can become life-threatening in a matter of minutes. That's why it's absolutely essential for anyone managing diabetes to always carry fast-acting sources of glucose, such as juice, candy, or glucose tablets. If you or someone around you suddenly becomes pale, confused, shaky, or unresponsive, don't wait. Take immediate action. Administer glucose or glucagon if it's available, and seek emergency medical attention if recovery doesn't happen within minutes. A blood sugar crash can occur at any time and in any place, and without fast treatment, the consequences can be fatal. Number 3, nerve damage. Diabetes doesn't only affect your blood sugar levels, it gradually destroys your nerves, resulting in a serious condition called diabetic neuropathy. What may begin as mild tingling or numbness in the feet can quickly progress to severe pain, total loss of sensation, and life-threatening infections. Many people living with diabetes don't recognize the severity of the condition until it's far too late, often when an amputation becomes necessary. The most dangerous part about diabetic nerve damage is that it masks serious injuries. When you lose feeling in your feet, you may not notice a small cut, blister, or wound. These seemingly minor injuries can worsen over time, turning into ulcers that refuse to heal. In severe cases, the tissue dies, a condition called gangrene, and once gangrene sets in, amputation is often the only way to prevent the infection from spreading further. High blood sugar also impairs circulation, making it more difficult for wounds to heal and for the immune system to fight off infections. Even the smallest injury can spiral into a medical emergency. In fact, people with diabetes are up to 15 times more likely to require foot or leg amputations compared to those without the condition. What makes this even more alarming is that once nerve damage begins, it cannot be reversed. It can only be managed. This is why daily foot care is absolutely essential. If you have diabetes, never ignore foot pain, numbness, or sores that won't heal. Check your feet every day, wear well-fitting shoes, and seek medical attention at the first sign of infection or damage. Diabetic nerve damage is not just about discomfort, it's a silent threat that can lead to the loss of a limb, and in the worst cases, even your life. Number 2, mental health breakdown. Diabetes doesn't just harm your body, it also wages a relentless battle on your mind. The constant pressure of managing blood sugar, adhering to medications, and coping with potential complications can take a serious emotional toll. Over time, this strain often leads to severe anxiety, depression, and even suicidal thoughts. Many people living with diabetes experience something called diabetes distress, an emotional burnout that makes it extremely difficult to keep up with daily care. And when treatment is neglected, the consequences can be deadly. Stress hormones like cortisol spike during times of anxiety, directly raising blood sugar levels and making diabetes even harder to control. At the same time, persistently high blood sugar can trigger mood swings, mental fatigue, and brain fog, which can leave someone feeling hopeless, confused, and emotionally drained. It's not uncommon for people to stop checking their blood sugar, skip medications, or make poor food choices, not because they don't care, but because they're mentally overwhelmed. This creates a vicious cycle of stress and declining health that can spiral into a full-blown crisis. Studies show that people with diabetes are twice as likely to suffer from depression, yet many cases go undiagnosed. Sufferers may isolate themselves, battle persistent anxiety, or have sudden emotional outbursts that strain relationships and self-care. The financial weight of managing diabetes, doctor visits, prescriptions, testing supplies, adds even more pressure, making consistent care feel impossible. This emotional overload can lead to dangerously inconsistent blood sugar control, missed appointments, or complete disengagement from treatment. If you feel depressed, anxious, or simply overwhelmed by diabetes, don't brush it off. Talk to a healthcare professional or join a support group. Getting help isn't a sign of weakness, it's a step toward survival. Mental health is every bit as important as physical health, and neglecting it can lead to severe complications or even suicide. Diabetes is a difficult journey, but trying to navigate it in silence is far more dangerous and potentially deadly. Number 1, deadly infections. Among all the dangerous complications of diabetes, deadly infections rank at the very top, and for good reason. Unlike heart attacks or severe hypoglycemia, which often trigger immediate medical responses due to their sudden and dramatic symptoms, infections develop quietly. They often go unnoticed until it's far too late. While a heart attack may claim a life in minutes, it usually comes with obvious signs. Infections, however, creep in under the radar, and by the time they become visible or painful, survival rates have already plummeted. A seemingly minor blister, ulcer, or cut can quickly escalate into sepsis, a life-threatening condition where bacteria enter the bloodstream and cause total body shutdown. Sepsis kills up to 40% of its victims and can turn fatal in a matter of hours. What makes infections uniquely dangerous is that they don't just target a single organ. They spread rapidly throughout the body, causing widespread inflammation, multiple organ failure, and death if not caught early. Even the best hospitals may be powerless to save a patient if treatment is delayed. Another reason deadly infections top this list is the reduced pain sensitivity that many diabetics experience, especially in the feet, due to nerve damage. Without this natural warning system, people often fail to notice a wound or infection forming. By the time they finally seek medical attention, gangrene may have already taken hold, leaving amputation as the only remaining option. And if the infection has already reached the bloodstream, even aggressive antibiotics may arrive too late to stop it. That's why we rank deadly infections as the most dangerous complication of diabetes, not because they're the most common, but because they're the most fatal and they provide the least warning. If you're living with diabetes, never ignore an infection, no matter how minor it appears. If a wound is slow to heal, looks discolored, feels warm, or has an unusual odor, seek medical help immediately. Waiting even a single day too long could cost you a limb or your life. If you have diabetes, it's crucial to listen to your body. Are you feeling constantly tired? Do wounds take longer than usual to heal? Have you experienced dizziness, confusion, or unusual weakness? Even if these symptoms seem harmless right now, they can rapidly evolve into life-threatening crises. Take them seriously and act before it's too late. Which of these symptoms surprised you the most? Drop a comment below and share your experience. We want to hear from you. If you found this video helpful, hit the like button and share it with someone who needs this information. The more people who understand the deadly risks of diabetes, the more lives we can save.